Many years ago, I served a few months as an internship at a London hospital. And in one of the corridors, I coincidentally met a man who changed my professional life and in many ways my personal life. The year was 1977, an important year for me, but due to Aubrey's Lancet paper, an important year for the dental profession. I spent 10 months in London, doing my master with Aubrey as a supervisor, was quickly a house guest with Helena's and Aubrey's, and was included in the Politics of Health group, meeting every Sunday afternoon at the Utkins. For me and many of us, he was a friend, a mentor, a colleague, and for me at least, the ideal big brother. During most of my academic career, he was supportive and often a challenging sparring partner. The World Dental Federation, which I am the privilege of being the chair of the science committee, is representing 200 dental associations in 130 countries, representing more than 1 million dentists. Aubrey's contribution to FDI, and as such to the organized dental profession globally, has been profound. This might sound contradictory, as we all know his views on the dental profession's ability to provide and promote oral health. However, during the last 10 to 15 years, FDI has taken on board many of Aubrey's thoughts and published documents which he has inspired. FDI is still producing materials for the dental technician, but the emphasis now is not on dental diseases, but on oral health. Now FDI is discussing how the profession can tackle the present and future challenges and opportunities and make a significant contribution to the improvement of global oral health. Aubrey's contribution to this cannot be underestimated. We can, for example, look at the Chernobyl Times and the variety of subject areas which Aubrey is quoted in the second edition of FDI's Oral Health Atlas from 2015. However, as we all know, and it's been repeated many times, his usual challenging way, he was still very critical. FDI is now starting a global periodontal project. A draft was written, and as many times before, I asked Aubrey for his comments. And let me read, I'm quoting from an email which he wrote to me a month before he passed away. Start quoting. The draft is a typical example of making a minor problem into a major one. Periodontal diseases are not important chronic diseases. The latest stages may be, but they are uncommon and restricted to a few teeth. Although the common risk factor approach is recommended and mentioned, there is no explanation of the logic and why it should be adopted. The logic is that oral cleanliness is strongly associated with body cleanliness. So public health approaches, as well as individual methods used by dental personnel, must integrate oral cleanliness with body cleanliness. Most professional approaches to control perio do not work and are very expensive because of long chair time. FDI should have a report on effectiveness of interventions. End of quote. And of course we are doing just that. About 2 weeks before Aubrey passed away, I visited him at home. He was weak, but we continued our discussion on the perio project. He was critical, as usual, but also gave valuable advice. Wow. This editorial, I think Luna mentioned it in the end, is from Journal American Dental Association, JADA, was initiated by FDI, published late November last year. Aubrey was, of course, the lead author, and he drafted the paper and followed up the other authors. You see, David, we are now on Index 1 with Aubrey's new index. The opening line is, approaches to improve oral health are relatively ineffective, yet costly. Several of the issues that Aubrey has often been working on are there. It was nearly like, you know, we started it before he got sick, but he continued and continued and continued working on it while he was sick. And it's all there. It's the sugar issue, the unsustainable social, economic, and impact of oral diseases, oral health with old policies, problems with the dental care system, upstream interventions, expanding the role of oral care professionals, and a new population-based model to promote oral health and general health. He wanted a press release simultaneously with this publication of the paper. He asked me to pursue this and asked Helena to send an email on his behalf just 3 days before he died. The FDI leadership is very proud of this paper. FDI is producing policy statements which are filtered down to the national dental associations. And let me share with you 4 of them, where Aubrey was the expert advisor and also wrote the first draft. They were all adopted by nearly 90% of the dental associations globally. So there is a long way then from the 1977 and the critics and what has been true until now, where 90% of all dental associations in the world actually is agreeing with him, so to speak, symbolically anyway. The non-communicable disease policy statement was adopted in 2013. The political declaration of NCDs was adopted by the General Assembly at the United Nations in 2011. It stated, in the beginning, oral health was not included in this, but through many people, FDI was one, and you can actually feel nearly Aubrey's soul there. It says that renal, oral, and eye diseases pose a major health burden for many countries, and that these diseases share the common risk factors that can benefit from common responses to non-communicable diseases. We are using this all the time to make a reference to it, because it's there, we can use it. And none of us is surprised, of course, that the common risk factor is included in this policy statement. The policy statement on social determinants of health and the one on quality of life show his concern for inequality in health and oral health, looking at the causes of the causes, and that he was a voice for those from the least developed communities of the world and inequality within any country, reminding us all of our social responsibility to address the needs and the will of people on the receiving end of professional services. The most recent example was a policy statement on sugar, which he helped formulating. Aubrey, together with David Williams, actually, provided input to FDI's behalf for WHO publication on sugar, on the new sugar guideline, which was published in March last year. He also helped organizing last year's World Oral Health Forum on oral health and sugar at FDI's annual Congress in Bangkok. The minutes from this session will be published very soon. The sugar statement will likely provide inspiration for FDI's toolkit, thus Aubrey's influence continues in very concrete ways. Given the subject matter of these policy statements, Aubrey's contribution has been in key items of national and international public health areas. And he has therefore helped give FDI a voice in oral health advocacy, as well as apply some of the science and evidence base for his interventions. And I would like to stress his continuous evidence-based seek. And I think a lot of his legacy in is evidence-based. Aubrey was not just an advocate. He was an educator committed to developing and nurturing a new generation of oral health professionals with his socially responsible set of values and skills. UCL and his program trained many who are leading today and will nurture and teach others. This could be his living legacy for many decades to come. On a personal note, this has not been mentioned at all. Have many of you tasted Aubrey's bread? You know, Aubrey's bread and Aubrey's fish. He came to Oslo once to he stayed with me because he was giving a lecture. He took over my kitchen and made bread and made fish. It was excellent. FDI is representing the global dental profession. Aubrey was critical, but at the same time helpful and constructive. The dental profession has a lot to thank Aubrey Sheiham for. Thank you.